Yeah.
Okay, so thank you, Dr. Aditya, for the opportunity to present here at this prestigious platform. So basically, I'm going to be speaking slightly differently. We are going moving towards lenses. I'm going to be talking about aberrations and optics of presbyopia correcting lenses. So this is quite a vast topic. I'll just be talking about all the recent updates and all the new things that have been happening, and try to explain some of the things of how we can understand these lenses better. So, most of the research and work that is developing today on presbyopia correcting lenses has something or the other to do with ocular aberrations. And these higher order aberrations are being used to, make newer lenses. So, it is important that we understand at least certain parts about this Zernike's pyramid, which tells us mathematically breaks down the aberrations. So, each of these aberrations you see has a top number which is denoted by M. This is the number of affected meridians, and the bottom number, which is denoted by N, which is actually the number of slopes along each affected meridian. So, the number of slopes, if they are two, they are lower order aberrations, and anything three or more are all higher order aberrations. Now, with respect to this presentation, what we are concerned with is Z20, Z40, and Z60. So 2 denotes a defocus, which is a lower order aberration, and 4 and 6 are primary and secondary spherical aberration, which are used by lens manufacturers to make lenses. So, basically, if light passes, parallel rays of light pass through a surface, which then converges that light onto a point, you have, in terms of aberrations, a zero order aberration going to a defocus aberration, because the resultant wavefront that comes out from that surface has two slopes. So this is zero to a defocus. So when you have zero to defocus, basically we have both the central and the peripheral rays focusing at one point, and this is also called as zero spherical aberration. But suppose our surface is slightly more curved in the periphery as compared to the center, then the peripheral rays will actually focus in front of the central rays, and this is called as positive spherical aberration. Positive spherical aberration leads to some depth of focus. Okay, and if we decode this surface, okay, it is nothing but a surface which has Z20, which is defocus, plus primary spherical aberration, which is Z40, because it has four slopes. Similarly, if the surface is such that the peripheral rays focus behind the central rays, this is called as negative spherical aberration, and this also induces depth of focus. So both these concepts are used to make lenses which increase depth of focus. Now, how much amount of depth of focus is required? So anything from positive to negative within the range of zero point 0.6 is considered good. Beyond zero point 0.6 is toxic. So lenses which use positive spherical aberration, we have the Ray 1 EMV lens, which in the central 2 mm zone induces positive spherical aberration. And for negative spherical aberration, we have the Technis Eye-Hans lens. These are two, prototype lenses which are using positive and negative spherical aberration. If we look at the surface of the Ray 1 lens, from the center to the 2 mm zone, you can see a monofocal lens in the red dotted line should be straight, whereas you can see the EMV has slightly more curvature around the 1.5 to 2 mm zone. So this is plus 0.15 of microns of positive spherical aberration. Similarly, if we look at the Eye-Hans lens, we see how the surface is much more curved in the central 0 to 0.5 millimeter, and as it goes towards 2 millimeter, the curvature is reducing quite significantly. So the curvature changes on the IHANS are much more defined than what we are seeing on the EMV. And why is this the case? It's simply because we are not considering a human cornea. The human cornea has a spherical aberration range of around zero point 0.3. So the IHANS is basically increasing that positive spherical aberration, whereas the EMV is increasing that positive spherical aberration, whereas IHANS is going against it. So if we look at the diagrams of EMV, we see that, along with the cornea, you're getting a significant increase in positive spherical aberration. Whereas if we look at the IHANS, it's actually not using the cornea. It's the lens itself is giving that negative spherical aberration and depth of focus. So these are extended monofocal lenses, and around 1.25 to 1.5 diopters of depth is what we can achieve with these lenses. But what if we want more depth without going to that toxic zero point 0.6 microns of spherical aberration? Then we have to use some other technology, and that is when your secondary spherical aberration comes into picture. So if you've got a surface like this, positive spherical aberration, okay, you get in another surface which has six slopes rather than four slopes. So because of the six slopes, actually you're seeing that the central rays focus on the retina, the mid peripheral rays in front, and the extreme peripheral rays behind. So this is called as positive Z4 and negative Z6. And this study shows that if you use positive Z4 and negative Z6, it gives the highest depth of focus. So there are two lenses which work on this principle. They are the Mini Well by SIFI and the Lux Smart by Bausch and Lomb. Both have a two-ring zone where the depth of focus is increased by using secondary spherical aberration as well. So we've got another lens called Vivity, which is a Nidorf lens, which uses wavefront shaping technology. So this is how a straight wavefront looks like. But when you induce this optical element in the center, as the rays converge on that one point, instead of focusing on a single point, they actually form a extended, stretched kind of wavefront. So that's how you get depth of focus. So, so much talk on depth of focus. But actually, what are we missing when we talk about depth of focus? We need to understand that if we are increasing the depth of focus, are we making sure that the visual quality is good? And can the same depth of focus be expected in every single case with the same IOL? So just look at this study, where they've shown two cases where there's zero point 0.2 and zero point 0.6 microns of spherical aberration induced. And you can see the depth of focus in zero point 0.6 is quite high. But look at the extreme letters. Okay, even though they are visible, they are extremely hazy. So is the patient going to be okay with letters at, this kind of contrast? I'm sure that, you cannot just go on increasing depth of focus. One very important factor is to test the contrast sensitivity at different depth of focuses, and that is done by something called as your modulation transfer function. And two variables of the eye that are extremely important in deciding the visual outcome are the pupil size and the corneal spherical aberration. So there's this new machine I learned about at the recent ESCRS called the Nemo, where you can put in an IOL in this machine, you can set the pupil size, and you can set the specific corneal spherical aberration and see what is the depth of focus and modulation transfer function of a particular lens. So just few graphs to show you. At 2 millimeter pupil, the eye Hans versus the Ray 1 EMV. You can see the different color codings are the different graphs at different spherical aberrations of the cornea. So the black is 0 and the red is 0.4. Now what you can see at a 2 millimeter pupil, irrespective of the spherical aberration of the cornea, the eye Hans is giving a larger depth of focus with a good MTF as compared to the Ray 1. And this is obvious because at a smaller pupil, eye Hans, you saw in the earlier graph that it has a larger curvature towards the central part. But when you go from IHANS 2 to IHANS 3 millimeters, you can see that now the depth of focus significantly reduces from 2 millimeters. Okay, and so does the spherical aberration come into picture. So if you go towards a higher spherical aberration, you get better MTF, and lower spherical aberration, the MTF reduces. And if you look at the Ray 1 EMV, at a lower spherical aberration, depth of focus is much lesser but a good MTF, whereas when you go towards higher spherical aberration, depth of focus increases but the MTF decreases. And then when you go to 4 and 5 millimeter pupils, you can see how much the MTF decreases. So you must be careful when you're implanting enhanced monofocals. The low light visibility for distance is definitely going to decrease in large pupils, even though it is an enhanced monofocal and not an EDOF. If you look like at a lens like Vivity, at a 2 millimeter pupil, you've got an MTF which is low, but you've got excellent depth of focus. So in a small pupil, it's got like a good depth of focus. But as the pupil size is increasing, you're seeing that the patients who have a higher spherical aberration, if you look at 5 millimeter pupil, right down here, you can see that depth of focus is good if the if the MTF is good only if spherical aberration of the cornea is 0. But if you're going to 0.4, the spherical aberration, the MTF is going really down. So again, pupil size and spherical aberration of cornea become important points. So, this was just an insight to tell you about these lenses. what the take home message should be is that you cannot apply blanket rule for all IOLs. Same IOL may have different effects in different eyes. And pre-op corneal spherical aberration and pupillometry are things that we can measure today. So they are important, especially when we are putting presbyopia correcting lenses. And understanding IOL technology is important before implanting. So yeah, those were some of my pearls with respect to presbyopia correcting lenses. Thank you.